Hi, my name is Dr. Jennifer Bahr. I am a naturopathic doctor and the founder of Resilience Naturopathic, a group practice that focuses on helping families with PANS and PANDAS recover using homeopathic medicine.
My name's Jody Putnicki. I am a mom who has had a PANS and PANDAS kiddo and navigated the difficulties of all of the school things as far as getting, accommodations for my daughter and trying to help educators understand what's going on in my daughter's world to help them help her.
And so Jody asked us to do this video together so we could help people understand a little bit more about what PANS and PANDAS is, the nuances of it, and some of the accommodations and things that might be beneficial for kiddos in an educational setting. And so we're going to start off with talking a little bit more about what PANS and PANDAS actually is. So PANS stands for Pediatric Acute Onset Neuropsychiatric Syndrome. PANDAS is Pediatric Autoimmune Neuropsychiatric Disorders Associated with Strep. PANDAS is actually a form of PANS. PANS can have an immune response that's occurring as a result of anything that can trigger an immune reaction. So things like mold, environmental toxins, things that the body sees as an invader and has an immune response to can trigger this constellation of symptoms. Most kiddos who end up with the diagnosis of with PANDAS end up having other sensitivities as well. And so these are kids that every time that they get exposed to an infection, that they have a flare of their symptoms. So let's talk a little bit about what the symptoms actually are, and then we can talk a little bit more about the diagnostic criteria and some of the nuances of PANS and PANDAS as it relates to functioning in school. So with PANS or PANDAS, oftentimes it can be a sudden onset, usually following an exposure to strep, mycoplasma, some other type of infection could also be a trigger. The symptoms are not always sudden onset. However, it could be something that has built up over time, or could have been a sudden onset, but was described as something that was developmentally appropriate, or that was just something that comes and goes, but ends up coming and going on repeat until it ends up being more prominent and not something that we can just explain away or wait for it to go away because it's there for the long term. So the symptoms typically associated with it are onset of OCD, intense anxiety, and especially separation anxiety. So these are the kids that could go to school just fine and no longer can because they can't be away from their parents. Emotional lability or depression, kids who are calm and docile suddenly having a lot of rage and anger. They could even get to the point that they have aggression or become a lot more oppositional, especially if they weren't oppositional before. We can also see developmental and behavioral regression. So these are kids that will start to act like they are 5, even though they're 10, or they suddenly seem to completely regress with their reading comprehension or their math skills. Their handwriting might even go backwards as well. There can be other deteriorations related to school performance, including refusal to go to school, also associated somewhat with the separation anxiety. There can be confidence regression because they're struggling with understanding things that they used to understand, and attention deficit hyperactivity type presentations that are associated with these other constellation of symptoms. Now, in addition to this, these kids will oftentimes have motor tics and sometimes vocal tics as well. These are different than the tics that you typically see with Tourette's or other tic disorders in that they start off significantly more complex. So rather than something that takes just a millisecond to complete, they are more complex and can take a full second or more to complete, and they're a lot harder to miss. That said, sometimes a tic can actually look like a cough, or it can look like dry eyes, or something that looks like blinking, and or clearing the throat, or something that could be associated with the illness that they likely had that preceded the symptoms. There can be sensory abnormalities too, so an increased sensitivity to all of the things in their surroundings. There's changes in food intake as well, what we call avoidant restrictive food intake disorder. So this can look like anorexia, where they're refusing to eat, or they're refusing to eat certain foods. Oftentimes there's an OCD component to it, where there's a lot of fear about the food that they're eating. And then there's somatic signs as well, including sleep disturbances, kids who can't sleep alone, can't sleep through the night, can't fall asleep, bedwetting in people who've already had potty training in the past, or urinary frequency or urgency, kids having accidents in school, or feelings of sensations that they have to go all the time, even if they don't. Jody, is there anything that you want to add there that I missed from a mom's perspective of what it's like to have PANS or PANDAS?
As far as symptom wise, no.
Okay. I want to talk just a little bit about some of the nuances to this. So if you want to get more information about the specific nature of the diagnostic criteria, this is something that's a clinical diagnosis. So there's not a definitive test. So we can't draw blood and find this specific marker for PANS or PANDAS. We can find things that are suggestive of it in addition to the symptom presentation that can help give some evidence that that's what's occurring. But there's nothing that can definitively say that somebody has PANS or PANDAS. So if you want to find out more information about the diagnostic criteria, I encourage you to go to PANDAS Physicians Network, and you can find the rubrics that are used to help with some of the decision-making of that clinical diagnosis. One thing that's really important to understand from an educator's perspective is that these symptoms wax and wane because it's an immune response that's causing these symptoms to occur. And so if there's an immune trigger, they're more likely to be elevated. And then when the immune trigger is resolved, they're more likely to have a reduction of symptoms or a complete elimination of symptoms. So oftentimes these things occur in like a sawtooth pattern with an increase in symptoms and then a decrease and then another increase, and it can continue up over time. Eventually it can lead to the point that it's just there, almost stuck in that elevated space with symptoms. It's also important to know that the symptoms can change from flare to flare. So if somebody had rage in their last flare, but not as much anxiety or OCD, that doesn't mean that that's exactly what they're going to have in their next flare. And that could be just because of progression of the condition. It could be related to the environment around it or what the trigger itself was, and how the body is reacting with that particular trigger. There are some kids who have a really hard time getting a diagnosis. In the terms of medicine, this is a very new diagnosis. It was first defined just over 20 years ago. And even though that feels like forever ago to me, it was not that long ago in terms of medicine. And so we're still really trying to understand it and tease out the differences from things that we already know that were triggers from strep, like Sydenham, chorea, and scarlet fever, and all of the impacts that we can have from strep in those regards, and how it's different from this constellation of all these symptoms occurring at the same time with the same person and then extending beyond strep. So there's still some just lack of understanding about this phenomenon that occurs. And there is some controversy in trying to sort through things. So some people will actually seek out a diagnosis and have all of the evidence to support it, as you will find on that PANDAS Physicians Network page. And yet the particular provider just doesn't have the education, or perhaps is part of a system that has taken a stance that they don't support the diagnosis of PANS or PANDAS, because that does happen where some entire healthcare systems have a policy that the providers cannot diagnose that. And so that can be part of the challenge. You can also see issues where people will get diagnosed with something else, in particular autism. There is a lot of overlap in the way that autism presents, and the fact that autism has a lot of immune dysfunction as part of its presentation as well. So there are a lot of kids who get misdiagnosed with Tourette's, with just pure OCD, with oppositional defiant disorder. I've seen a lot of kids get misdiagnosed with pediatric bipolar disorder or disruptive mood dysregulation disorder that actually have PANS. And then autism is, again, one that can have both overlap or can sometimes even be misdiagnosed. So I've talked a whole lot. We wanted to make sure you get the mom's perspective here. So Jody, can you share a little bit from the mom side what it's like with having a child with PANS or PANDAS?
Yeah. And I want to share this with you all because likely if you have a mom that is sharing this video with you, there's probably a pretty good chance that you're hearing about PANS or PANDAS for the first time. And, it was whenever I took, what was going on with my daughter for the first time to schools, I got met with some very understanding teachers and admin, but in our community there's a whole lot of people having a really hard time getting help because PANS and PANDAS is so misunderstood or not yet understood. So what this looked like for my daughter, she was a perfectly healthy, happy little girl. She absolutely loved reading. She was obsessed with school. She was a kid that would cry if she couldn't go to school for some reason. Developing sleeping well, no, a little bit of, extra getting sick, but there was just nothing that indicated to me that anything was wrong. And her onset wasn't overnight. It was a little bit slower, but there was a definite significant onset of these symptoms that started to happen. And kind of around the school setting was where I first realized that there was a problem with like having issues with friends. And for some reason, all of a sudden, her reading skills, her math skills, her ability to pay attention, her goofing off in class, all things that were not previously my child, were all of a sudden happening. And it just kind of snowballed from there and got worse and worse and worse. I did not have a diagnosis for my daughter in the beginning whenever I was trying to get help with school accommodations and stuff like that, because, my daughter's onset was many years ago, and there was even less information about PANS and PANDAS. And that's one of the things we're working to try and change, is to get more information out there, so people have at least a little foundation of what it is. My daughter had all of the symptoms that Dr. Bahr talked about earlier. I won't go into all of her symptoms, but it was just a cascade of like one right after the other, until the point where we got like probably 3 months in, and I didn't recognize the child that was in front of me. It was not the daughter that I had 3 months ago. She was an empty shell of herself, and her entire life had just been engulfed with these symptoms. And our lives were complete and total chaos. And, my husband and I were doing the best that we could to navigate what was going on, but we were confused about it. We were trying to continue her education, continue her in public school, but also help other people understand what it was. So I really just want to talk a little bit about the symptoms that she had that really made school difficult. And this is things that, if you have a PANS and PANDAS child in your classroom, you're likely going to see. But then also outside of what I talk about, there's a whole lot of other symptoms that go on. There's a lot of struggles that other children have that my daughter didn't necessarily have. So talking about anxiety, she had really extreme separation anxiety. It made it very, very difficult for me to get her to school. At the same time, she had OCD. In PANS and PANDAS, OCD doesn't necessarily look like hand washing. My daughter's OCD was wrapped around reading Bible stories, and she had to read them to me in a certain way. And if it wasn't done in a certain way, she would have to start over. This would happen every single morning on the way to school. We were late so many times because she was stuck in this loop of not being able to get this thing done a specific way. Her sensory issues, I couldn't get shoes on her in the morning. It was a fight to get clothes, shoes, whatever on her to get her out of the house. There was a whole lot of being late to school, and a lot of times not even making it to school. She had sleep issues, so she was tired at school. She would be completely normal, and then when she would go into a regression or she would get an infection and get worse, she would have extreme ADHD. She would have lapses in memory where she couldn't even remember stuff at all. She would go from reading and writing perfectly to not even being able to read a sentence to me. All things that made learning extremely, extremely difficult. She had, all different kinds of tics, many of which were causing issues for classmates because they were noise tics, they were coughs, they were sounds, they were movements that she could not control, that were causing distractions in the classroom. She had profound sadness. She was like this all day at school. Most of the time, she knew all these things were happening and she was embarrassed about them. And she tried so very, very hard to hold them in. So some days she was perfectly fine. And then other days she just couldn't hold it in. And all of this stuff came out at school. She had anger and rage. 90% of the time she could hold that in at school. Those things wouldn't happen. But sometimes they did come out and it happened at school. And all of these things were things that, she needed accommodations to help her throughout her day. And so really just understanding that, everything that was going on with my daughter was really stemming from inflammation in the brain. These symptoms weren't my child. My daughter was a good kid. I was a good parent. We were doing all the things that we possibly could to help her. But while we were still in it and things were really bad, we had to have the support of educators. And again, I got really, really lucky and had some understanding educators that even though they didn't understand PANS and PANDAS, they did understand that we were, as a family struggling. My daughter was struggling and she needed some help.
So the nature of this video is not such that we really want to talk about treatments per se. There are a lot of different things that can be helpful. That said, there's not one thing. So it's not like there's you're just given medication for ADHD and it's taken care of, because these kiddos are very sensitive and their systems respond very differently to things than they would otherwise. So even if you're looking at the PANDAS Physician Network and seeing some of the recommendations for treatment, what works for one child is not likely to work for another, and what works for one flare is not likely to work for another. And so we just want to make sure that you're aware of that, and that it's not a matter of like just getting them on the right treatment regimen and everything will be stable. It's a very fluctuating condition, even while they're doing their healing and using medications, natural therapies, homeopathy, you name it. There are going to be ups and downs and fluctuations in the course to recovery. And this is something that kids can recover from. But what we really wanted to talk about most for you today, and what we want to wrap up with, is some possible accommodations that have been useful for Jody and her family, as well as for other members of our community. And then we asked some members of our community what they really hoped that educators would know as it relates to PANS and PANDAS. So let's go ahead and dive into the possible accommodations first.
Yeah, so I think like any of the accommodations that we're used to seeing on a 504 to be expected, things that really, really focus in on what is going on with the PANDAS kiddo and supporting them through their day. Things that we had to have were, the allowance of extra absences and tardies due to, my daughter being sick on a regular basis, me not being able to get her in school. My daughter literally had an entire plan around getting her into the school. We had administrators meeting us at the door. We had a special place for her to go before she went into the classroom so she could kind of acclimate and calm down and get used to that setting. And then she would be moved into the classroom and move on with her day. There's restroom accommodations. Our kids often have, the urinary frequency issues, and, we need our kids to be able to get up and move to the restroom when they need to. Things like frequent trips to the counselor's office or to the nurse's office. My daughter had a special area in the counselor's office for her whenever she would get overly emotional, when she would get angry, when she was struggling with transitions, whatever it was, she could always go to that spot in the counselor's office and it was available to her. And just simply having that little calm down area for her helped her, help comfort her, and help her feel like she had a safe place at school. Plans to de-escalate anxiety and anger, just little things that a teacher can do to help a child when they recognize that they're going into one of these bouts of getting upset. Note takers for children that are having trouble writing. Extra time, of course, on tests and assignments. A lot of times with my daughter, it was modified assignments because she just simply couldn't do it. Not because she wasn't, she was a great student before PANS and PANDAS, but she just did not have the capacity to do the things, and the ADD made it much, much worse. Attempts to redirect behaviors rather than reprimanding. Discipline does not work very well on a PANS and PANDAS child, and disciplining often escalates rages and anxiety and a slew of other symptoms. So just other ways to deal and handle those situations. Frequent breaks to regain attention, prompting to help students stay on task, like I said earlier, quiet spots to regroup and kind of de-escalate. And even with some kiddos partial homeschooling. Some just don't have the ability, because unfortunately with PANS and PANDAS, there's also in some cases physical pain that comes along with this, pretty significant GI issues. Some kids just can't do a full day at school. So there's a whole lot of other accommodations around food allergies, because often our kids need to be on specific diets and eat specific foods. There's a lot of different things, but just mainly accommodations to help them through these symptoms that they're experiencing on a day-to-day basis.
And obviously neither of us are educators or education administrators, so we don't know all of the possible accommodations that are, and we realize that there are a lot of challenges. I am the daughter of a teacher, so I realize that there are a lot of challenges with providing accommodations. That said, we can't possibly cover all of the things that a kiddo might need, nor do we know exactly the process. We're just trying to help you understand some of the things that we have seen in our work with thousands, literally thousands of families. And speaking of those families, we wanted to share with you some of the things that they routinely say that they wish that educators or other people knew about PANS or PANDAS. And one of the main things that people say is that they really wish that they understood that it's not bad parenting or a disobedient child, that most of these kids are really good kids, but they have an infection that's actually caused inflammation in the brain. I didn't talk a whole lot earlier, just in the interest of time, about the exact mechanism of action that's proposed for what occurs in PANS or PANDAS, but it does involve brain inflammation, specifically of the basal ganglia, and there can be impacts on the prefrontal cortex as well. And so knowing that like this is an inflammatory response that's driving the behaviors in these kids, and that they would stop it if they could, and they frequently say that I can't stop, and they literally can't, and then they show remorse when the inflammation settles down.
Yeah. Another one is that, and I touched on this a little bit earlier, our PANS and PANDAS is ever changing, like daily changing. Our kids can hold it in sometimes, and then other times they can't. And that's the same thing with the fluctuating symptoms and how symptoms look different. Things change. What the things that, you know, you might have to deal with one day, it might be completely different the next day.
And it might be that you've talked to a parent and they've asked if you see anything like this because they're struggling at home, or that they're not able to get their homework done because they're struggling at home, but you're not seeing it at school until eventually you do see it at school. Another thing that is important to know is that the behavioral stuff that you're seeing isn't always something that can be addressed with a behavioral intervention, because it's actually a neurological impact from this inflammation in the brain.
Yep. And like you said earlier, the stimulants and the psychiatric meds often don't work. There were a whole slew of things that we tried on my daughter that didn't work for her. We had doctors recommend that we put her on ADD meds. My daughter didn't have ADD. My daughter had an infection-driven condition. We had one doctor recommend that we start treating her as as she was autistic, and getting accommodations for her and getting therapies for her. My daughter wasn't autistic. She was one kid one day, and then the next she was another kid. And so all of those things that everyone felt like that I should be doing for my daughter, I knew that those weren't the things that I needed to be doing. I needed to be focusing on how can I heal her body, and how can I get her out of these symptoms that just popped up seemingly overnight.
And one of the challenges is not only are they not necessarily appropriate because they're for something that's not what these children actually have, even if they have a symptom that is similar to another condition. These kids, as I said before, are really sensitive. And so sometimes, especially psychiatric meds, can actually make their symptoms worse because they're very sensitive. And so a psychiatric medication given at a normal dose for a kiddo can actually make them significantly worse. And sort of touching on what Jody just said, a lot of times these kids don't respond to like the typical common interventions. And that's one area where we come in as our focus and specialty with homeopathy does seem to work really well for these kids, especially when all of the things that people typically go to with conventional medicine and even natural or integrative medicine fail to work, or work for a short period of time, but fail to hold, and then the condition progresses.
And our goal as parents is definitely not to overload you guys with accommodations or unnecessary accommodations. We really want to try and help you help our child and have the understanding that we're working on healing our kiddos. We're trying to get them out of this as quickly as possible. So we're definitely not trying to overwhelm you, overload you. We understand that you have, likely 15, 20 other kids that you're dealing with. So we're trying to enable you to navigate our child as best as possible and try and teach you some of these things that help us help our child through this to make your day easier and our child's day easier as well. Just really trying to be teammates and help each other through this and meet each other with compassion, because we definitely understand that, I know that my PANS child in a classroom is extra for the teacher. And so if there's anything that I can do, any accommodations we can work on together, and we can kind of have this teamwork with my kiddo until I could get her healed and recovered. It benefits all of us, and especially my child.
So hopefully this was a helpful video in getting some basics about PANS and PANDAS and what it looks like, and some things that can be supportive for families going through it. If you want to learn more, I again encourage you to go to pandasphysiciansnetwork.org. Or you can also, if you want to learn more about the approaches that we take, you can visit resiliencenaturopathic.com. Otherwise, we hope that you'll have a lot more understanding the next time somebody comes to you and tells you that their kiddo either suspected to have PANS or PANDAS, or that they've actually been given that diagnosis.